On the day the indoor mask mandate is lifted for vaccinated people, we welcome in San Luis Obispo County Public Health Director Dr. Penny Borenstein via Zoom. So let's talk about lifting the mask mandate. The county's in line with state guidelines here. What goes into making the decision, and why is now the right time?
Well, I think primarily we wanted to minimize confusion. We've heard from people throughout the pandemic when rules are different at the federal, state, and local level, that causes confusion for people and challenges in knowing what to follow. So that was one of the main considerations, was wanting to align ourselves with the state. Also, we think that now is the right time because we are seeing dramatic decreases in the number of new cases. 75% decrease statewide, not that far off locally. There are more treatments available. So with this Omicron disease, it hasn't been quite as serious for people. Our hospitals are in much better shape than they were on the downturn of our last surge. We were dealing with the Delta variant, which was much more serious. So all things considered, and quite frankly, if I'm honest, people are really tired of not getting any benefit from getting vaccinated. Their risk is considerably lower amongst vaccinated people. And so while we still do recommend, especially for vulnerable people, that they do wear masks, especially in crowded situations, that those who want to take their masks off among the vaccinated can do so at this time.
The next step many people are asking about is masking at schools. The state says it's going to look at the numbers again and discuss school masking policy at the end of the month. What's the COVID situation in SLO County schools, and do you expect the county to be in line with state recommendations on that as well?
Yeah, for the same reasons that I said with the general rule for the population, we are almost certainly going to align with what the state decides on the school mask order. We cannot be less restrictive, which many people have been asking me to do, but nor will we likely be any more restrictive going forward. If the timing is right to allow students to also take off their masks among the vaccinated students, then we will align with that.
Public health guidance has adapted to the changing conditions throughout the pandemic, looking at vaccinations, hospitalizations, variants, rapid spread of the Omicron. Now that things are calming down, apparently, what's your guidance to a healthy person who is fully vaccinated and boosted, maybe even recovered from a mild case of COVID during this surge? There's a lot of people who fit that bill, including myself. Should we feel safe to return to some sense of normalcy now?
Yeah, I think there's a lot of people in the community that need to start progressing to getting out, doing their normal activities. There's nothing to be gained from isolating. Mental health really requires that we do engage in gatherings with, socializing with our friends and family. So I think unless you've got a really vulnerable person, even vaccinated vulnerable person, I would suggest that we still mask wear in those situations. But for most people who are vaccinated and boosted, you can really feel generally quite safe about going about your daily lives like you used to.
Okay, that is encouraging news. Dr. Penny Borenstein, thank you very much for joining us today.
Thank you.